Dr. Tabinda Saroch, who is the CEO of Pathfinder International, is an expert on the intersection of health, gender, and climate, working to ensure women's voices and experiences drive resilience strategies. And finally, Mr. John-Arne Rottingen, who is the CEO of the Welcome Trust, who offers a critical funder perspective, particularly in this moment, with a career devoted to building and sustaining global health financing and partnerships. Join me in welcoming our panelists. Starting with you, Dr. Carr, you've argued that healthcare and public health too often run on parallel tracks. Where do you see the greatest opportunities to braid those more tightly together?
That's a great one. The fact that they've run in parallel and haven't intersected and communicated and in fact have turf wars is very much an American problem, which is something that ideally we don't export to the rest of the world. In many places, the Ministry of Health has a shared responsibility, as this room certainly knows, for what's happening in the public health space and what's happening in the healthcare space. And I guess I would say that the opportunity there is for us to learn from our international partners as we engage with them and try to figure out a way to really thread the needle on both. We have two key partnerships. It's okay to talk about this a little bit. We have several, but two of the big ones for us. One is in Guyana, one is in Nepal. They're structured differently, and I'm happy to take a little bit of time later to unpack them if it's helpful. But what we realize is that when we engage with folks that deeply understand what's happening inside those countries, they articulate for us the connectedness that somehow in the U.S. gets lost, which is to say, building a public health infrastructure that bridges into primary care and preventative care and accounts for, as you talk about, zip code as a great predictor of your health outcomes. That's critically important, but so is the downstream, and making sure that there's capacity on the downstream to take care of referral disease really paints the entire picture of health and public health in a way that we would all want it to be. So we try really hard to learn and to be humble about not creating the same boundaries between the two that exist too often in our world.
This question is for all of you, but perhaps starting with Dr. Saroch. Building hospitals abroad is often framed as progress, but how do we avoid white elephant projects and instead create adaptable, sustainable systems of care?
Thank you so much. Firstly, very grateful to be here, and for those of you who don't know Pathfinder, we are a women's health organization. We've been here since 1957 and worked in 120 countries across the world. And this question that you ask is very pertinent for me because we've been programming on the nexus of health and climate for some time now. I've traveled here from Pakistan, right, leaving behind a country which is facing lots of floods. And 2 years ago, when the floods happened, 625,000 women were pregnant and displaced into the campsites, and 65,000 pregnancies were taking place every month in the campsite. So when you talk about adaptation and readiness, this is what is going to become a regular feature if we do not invest into health systems that serve women and children right now. And I'll give you another example from our work in Bangladesh, and where cyclones hit us regularly every year, and yet in the shelter homes, women do not find simple things like menstrual hygiene products. Girls who are sometimes left in the shelter homes for days when cyclones happen do not have access to menstrual hygiene equipment. And for them, that is a very catastrophic situation. And when we talk about building climate resilience, that's what we mean. We mean building resilience of the communities, of the women and girls themselves, but most importantly, the systems. Why have not our systems been developed to absorb this? One, because we are overburdened. Countries that we work in are low and middle income countries, and we need better and more innovative financing and governance schemes, I guess, to carry that forward.
Mr. Rottingen and then Dr. Carr, same question. So this idea of building hospitals Something I often see wealthy donors want to do and have it named after themselves. But how do we avoid a white elephant and instead create adaptable, sustainable systems?
So I was very pleased to hear Dr. Barbosa talked about health as an investment. So it means an investment in people, it means an investment in human capital, it's an investment in society because we create jobs in the healthcare sector. It's almost 20% of the economy in the United States, it's 10% of the economy in OECD countries, maybe not more than 3 to 5% of the economy in developing countries, but still, it's a substantial part of the economy. And then we also have health industry, and I think what we're seeing now is a call for looking more at health as an investment, but it's also a human right, and I think that's also a starting point. And why do I say that? Because who are responsible for human rights? It's individual countries. We heard a lot this week about sovereignty. It can be framed in the negative way, because in a way it can be framed as we are in it for ourselves only, or it can be framed as we take responsibility for our citizens and our people. What we have seen coming out of the pandemic is really more and more leaders from the global south, from Africa, from Asia, from Latin America, taking responsibilities for the health of the populations. But that responsibility needs to start with the basics. It needs to start with community health. It needs to start with primary health care. And that's why I really agree on the fact that healthcare systems and public health needs to be seen in conjunctions. If you have very limited resources, you need to start with the most cost-effective interventions. The most cost-effective intervention in health and public health is vaccines, just as a starting point. And then we have cost-effective interventions to really make sure that children survive, mothers do survive pregnancy and birth, and then we need to build on from there. So I would not say hospitals is the first investment. They are necessary, but they need to come after we have done the basics right.
Dr. Carr.
I'm just grateful that it's not the healthcare guy that talked about healthcare, business, and finance first. That makes me feel good. Because it's a